Welcome to the Master Sharpening Stone, a place for healers of diverse paths and abilities to sharpen and polish their skills. The path to mastery is never ending because mastery is not a fixed destination. Hi, this is the third podcast on the Master Sharpening Stone. I am here with my favorite chiropractor, Dr. Michelle. And we're live and in person. First one, not over Zoom. So I want to get right to the nitty gritty. What inspired you to do healing work?
I didn't even know what chiropractic was when I decided I wanted to be a chiropractor, actually. So I originally started at the university as a athletic training technician, someone who worked with all the broken athletes or athletes who need rehabilitation inside the system. And I noticed that there was not very much preventative injury maintenance or skills taught to help keep them strong other than what is classically known as athletic training and like their conditioning programs. And so it made me wonder in the rehab why we didn't have that kind of built in for them. And so I developed a more a stronger interest in prevention rather than rehabilitation. So then someone casually suggested chiropractic to me, and I researched it, and online it was a really cool way for people to invest in the care of their health or their function, and in that way I was sold already right off the bat. Edit that out.
But so you got into the athletic training via what method? Like what brought you to that?
Oh, well, I originally started at school in undergrad education because I wanted to do osteopathic surgery work, or like basically show up in med school, be pre-med, do the whole stereotypical, how do I get access to the medical care system? And then I discovered that the surgery drug model was not really for me. I was much more interested in education and how to make people awesome before they even had to come to those means of care.
Did you have any mentors like earlier on in your life that were like other people doing healthcare of some sort that you're like, oh yeah, I kind of want to,
Nope.
I want to be like them when I grow up?
I knew in kindergarten that I wanted to be a doctor of some sort.
You knew?
Somehow.
Okay. Did you play like with your animals and put little band-aids on them?
Weirdly, a little bit, kind of. No adjustments because I didn't know what they were. I thought a chiropractor was kind of just a weird doctor, and I asked my parents when I was a little tiny child about what chiropractic was. What was that doctor person? And my mom recorded something in my memory like, oh, that's not really a real doctor. So I didn't even pursue that thought process until maybe my last year of undergrad. And then someone said, well, have you thought about chiropractic? And I said, I don't even know what that is. So I went to the Great Google, and the Great Google was like, hey, this is medicine without drugs and surgery. And I said, wow, cool. That's how I got there.
Mom, she's a real doctor now.
She knows.
So what is, since I want to jump ahead a couple of questions because you mentioned like the osteopathic and stuff. Mm-hmm. What is the difference between like the different styles of chiropractic and osteopathic medicine, and how do you differentiate those things on the more finer points?
That is such a good question, because I don't think that an osteopathic provider or which we call a DO, or a chiropractic physician could answer that question without like being skewed toward their discipline. The way that I was taught that history is that an osteopathic manipulative adjustment is very similar but more general than a specific chiropractic applied adjustment. But if you ask an osteopath, they may say something different. So I think it's about the intent in which it's done, and I think it's about a systemic approach rather than just a complaint-based approach. And a lot of osteopathic providers now do medicine, and they even do some surgeries and some stuff like that. Lots of them are holistic, lots of them are not holistic. So for me, chiropractic is very much about how I can make a little part of you contribute to a much greater whole of your well-being, and how I can get you back to the function that you want to be. I'm a very functional focused provider, which means that I just want to get you back to what you want to do, and then hopefully without pain. And if that means play better chess or play better video games, or that means go be like an elite triathlete, then that's what I want for you guys.
Because the little piece affects the whole, right?
Yes, totally. Totally.
And that's why the style of acupuncture that I do, the chiropractic that you do, work so well together, because I have the same approach.
So much.
And that's why we share so many patients.
He's the best. I would take you with me everywhere I went in my future so I could work with you on patients. I think that your approach is phenomenal.
Yeah, I feel the same way. Much.
Thanks.
So there's a couple other more subtle things too. Like I've heard about network chiropractic, and some
Not much
other,
I know about, but not
Okay.
much I know about. There is a whole collection of chiropractic techniques, probably 200 plus. So we're talking about minute differences where we just call it a different word, and it's really the same thing. And we're talking about vastly different feeling approaches, like when I adjust you from one method to another, where you're like, wow, that's chiropractic, or oh my gosh, yeah, that felt like the other guy. So it's very nuanced or very definitive, like a box of crayons.
So that's something I feel like we also have in common, and I don't understand it from your perspective yet. But when I needle a patient, there's a dosage, right? Like
Yeah.
we don't talk about dose like how many milligrams, right?
Mhm.
But there's a dose of like how much pressure, how deep, how long you hold that needle, how long you retain it. And I feel like you have the same idea like in your hands, and I don't know if it exists as a
Yes.
as a spoken concept within your profession.
It doesn't, I don't think. There's a formulaic approach to chiropractic, which is a way to westernize it and make it, chiropractic is already Western, but it's a way to make it like a little bit more tangible to insurance companies who want to like reimburse a care for chiropractic. But to me, when you come in and you have a chiropractic complaint, it's pretty individual based on your environment, your stressors that you live with and deal with every day, your activity. It could be also the stuff that you do like recreationally. It could even be how bad that discomfort is causing you pain or loss of function. So a general rule is if it's an immediate stressor to you where you feel physical pain or something, then I want to see you a little closer together. But your body will tell me when you come in, and it always tells you too, but we just don't pay attention to that. It will, it's a real thing, but it tells me when you're on the table and I'm adjusting you, and it tells you as the patient, like if it went away and then it came back, or it got really cold and now like my neck hurts and I can't turn it again. That same thing tells me what your dosage should be. So dosage to me is probably a couple of days where I wait for your body to have a response, significant. If I know that I am doing relief care is how much that's going to inhibit your regular life that you want to do. Like, can you get out of bed? If that's the case, then I might want to see you 2 days back to back, or I might want to see you like 3 times within the first week. But I usually limit my current care model to relief within the first week. By the second week, I'm already working on your recovery and how we can maximize you to return to the things that you want to do. And then the third phase of care is pretty much like wellness care and maintenance care. Sometimes that means how long can you go before there's a chiropractic intervention, or sometimes it means I feel great and I know that chiropractic every 2 weeks will hugely enhance my life. Sometimes it's 2 to 3 months for some people. So it really varies,
Hit their
honestly.
stride.
Yeah, so I don't like the prescribed 3 times a week for 2 weeks, 2 times a week for 1 week model, I guess we could say. But it depends if you're in a personal injury setting, or if you're in like immediate pain and I'm like chiropractic 911. You went to the chiropractor instead of the hospital for I can't get out of bed in the morning. Depends.
So in that kind of situation where it's very emergent, I can also see how like in my profession where something is so intense at the moment that like I only focus on certain aspects of it and leave other things that are still an issue to the side for the moment to come back and deal with later. Can you speak to that a little more, like specifics?
Sometimes I'll have patients who are so sensitive about how their body handles the triggers I'm giving it, that I can only do a little bit. I need your body to respond to what I do. I don't fix you. a chiropractor doesn't fix you, is probably what we say. Your body fixes itself. And so my job is to trigger a response that is going to be palliative to you and bring you back to function or bring you back to your health. Sometimes chiropractors do things that are not, work with issues that are not musculoskeletal. It's still a body response and it still is on a timetable. But if I don't give your body an opportunity to respond and neurologically overwhelm it, then your experience is not positive and you don't want to come back to me anyways. So yeah, that's a sense of a good chiropractor. I think knowing when too much is too much for a patient also widely varies, but you have a really good sense as soon as they walk in the door and they're like, here I am, even if they're new, you have a pretty good idea of that.
So you can pick them out when you see them, like, okay, this is like about where the dosage is for this person.
Yeah, and I always am more conservative on my approach, so I'm not going to do everything on first visit if you're brand new to me. So sometimes we watch these cool videos on YouTube and we see somebody use the Y strap, which is that like traction that people will use at the base of your skull for literally cervical traction. And you always hear all these great pops and cracks and stuff. That is likely not the first time that patients had that adjustment. And if they had it before, they loved it and they respond really well to it. And that's how they got on the video. But a first patient doesn't show up saying, I know I'm going to tolerate that really well. Will you please yank my head off? It looks untechnical. It's not untechnical, but it looks weird. Those experiences are rare and far between where the patient can go, give me everything, and then not have a side effect the next day. Side effect, by the way, the most common is muscle soreness after the adjustment, because I moved all these things and all the muscles attached to those. And so then your muscles are like, man, they're a little sore after Dr. Michelle did this adjustment. It goes away with heat.
So sometimes there's like a rebound spasm.
I don't know if it's a spasm, but it's definitely a neurological overload every time. It may not be a spasm per se. If I did my job correctly, you don't walk out with anything you didn't walk in with. So you should have no more extra pain. You should not have a headache. You should have diminishing symptomatology of all the things that were wrong. But there's a response, and sometimes the response is not comfortable, and that would be like, oh man, I still have some range of motion loss right there. Well, your muscle needs a little second to notice something changed, and that's a actual non-cognitive process. Like your body doesn't go, I'm immediately going to change that, because it has to get that neural feedback loops.
So a lot of times I have patients that want to come in and they want to get like a massage and then go to the spa and sit in the hot tub and then get acupuncture. I'm like, whoa, slow your roll. Like, how about do some of that tomorrow or the next day? And so one of the things that I usually tell them though is like, because they'll ask me like, I'm going to get a massage after this. I'm like, no, please don't do that. Get a massage tomorrow. But when they say they're going to get chiropractic, I usually tell them that's fine. Don't get a massage or another acupuncture later or anything like that. But to get a chiropractic adjustment is fine, because it doesn't, what I see clinically, I don't really like have this, nobody said this is the pattern to follow, right? But like what I see clinically is that it doesn't mess with my treatment. But if they get a massage after, the effects of my treatment will be less later. Or it could also be overdosed for them and then they feel worse the next day, right? Yeah. And so I usually tell people like, when they're leaving, go see Dr. Michelle.
I do see a lot of patients, we share some of the same patients on the same day. And I'm fine with that, unless it is their first acupuncture treatment. And then I want the acupuncture treatment to be uninterrupted by my care. There's all the meridian maps all over your body, extra special points. And sometimes I stimulate those just by touch, like through acupressure, technically. So I don't want to undo, like bladder meridian runs all the way down. I don't want to undo any of your work. So usually if it's going to be a first acupuncture treatment, I tell them to alternate between treatments. I do that with massage a lot. Massage on a first day of chiropractic, for instance, can be a little much, just like you noted. I think that a patient who is not new to massage or acupuncture or chiropractic could probably do all three on the same day. If you're new to one of those three disciplines, it's probably not a good idea to have any kind of those in tandem with another adjustment. I just think it's a lot for your body to process.
What about like sports activities?
I love sports activities. So one of my biggest activity recommendations is to stay moving, stay active, keep those muscles working, and giving positive feedback for what you want your body to do. So a common example of that is, well, my glute muscles right here are not working correctly. I have lower back pain. I have trouble standing up, and just it feels uncomfortable. So my low back hurts. Okay, well, after I do the adjustment, I'm going to traction all this stuff. We're going to trigger these muscles to do what they're supposed to so they can support your legs, and your leg muscles are no longer doing the job that your glutes were supposed to do, that your low back was doing for you. So then I will tell that patient, use heat, go work out, stay active, walk, do what's called active rest. Don't do anything you wouldn't normally do, like climb a mountain or skydive or something. But your regular stressors that you do well with are usually helpers to help get you back to where you want to be. So if acupuncture is part of your normal formula, and everybody has their own formula, keep with the acupuncture on the same day even. I also find that patients that we co-treat do really well on the same days of treatment.
Yeah, I think because the style of acupuncture I practice is very much Wei Chi level, so it's mostly surface because I don't insert a lot of deep needles. What messes it up is like directional things. True. And so because most of the work that you're doing is inward,
yes,
like with the activator or the adjustment, right? It's not directional, like whereas a massage therapist is gonna rub like up and down.
Yes.
And that scrambles everything.
That's a really good thinking point, actually. Most of my work is very specific to one segment, and a segment is 3 motion units. So that means that I'm aiming for a specific vector or movement into a joint restriction. So you're absolutely right. It's not a global thing. There is chiropractic that is a global thing. For instance, a low force, low amplitude adjustment might be more indirect. But specifically, the point is to get movement and motion restriction in the spine or extra spine.
So let's get into some more of that stuff. So you've got the activator, and there's like the drop tables, and there's the adjustments where it's just like pushing one very specific place to move something, and then there's the ones where like you twist like the whole spine. What are the differences in all these different approaches? Why do you choose this tool for this person in this situation and that tool for another person?
The current model that I'm working in has 3 visual tools that you'll see me doing, and that consists of the drop table, which is actually called Thompson, and I don't actually practice true Thompson because I don't have all of the appropriate drops true to that technique. I have activator, but even the activator technique is very specific and requires foot checks and all kinds of proprioceptive checks that I may not have time to do in my current setup. So actually, I use this as an adjunct chiropractic tool. My main technique is diversified manual, which just means I use my hands to do it. And then I'm palpating to find the area I need to put the work into, and correcting a motion unit where like those 3 vertebrae don't move all the same way, or there's muscle restriction or motion restriction. So global motion will be the whole part, like your whole middle back or your whole hip, for instance, versus a segmental unit, which is like a bone on bone. So in that case, when I'm picking my 3 tools, I need to know what's wrong with you, what I want to get out of that adjustment, and then what your patient preference is. So if you hate this noise and it's a trigger for you, I'm probably not going to use much of that tool. Some people really don't do well with the drop table. Some people hate a side posture, which would be the example of the thing that you said, twist the whole spine. Even that can be very specific, and sometimes that can be very general. So that's a long axis where I'm using your leg bone down here to adjust something in here, which is how I twist your body, or what area I put the motion in at the top or the bottom and let your body do the rest of it. I just pick what you prefer or what skills I have. But I use mostly high velocity, low amplitude, which is a very quick adjustment in a very specific small movement. That's the low amplitude part. I don't do very much low amplitude, low velocity, although I think that you wanted to know some things about like lymphatic drainage and maxillary sinuses. Those are more of my low velocity, low amplitude tricks, I guess we'll call it, which come out of something called sacro-occipital technique or craniosacral, where we're making small movements to actually create a response in which your body does something like that. My personal skill set is trained in something called Logan Basic, which is all pelvic ligamentous work, where I hold a specific ligament and I can move up and down your spine with really small pressures. And that's not high velocity at all. So
is that working more like on the fascial structures, or is it working on the nerves?
my points of contact are actually vertebral elements, but there's a ligament that runs through here called your sacrotuberal ligament that connects to the tuberosity of one bone to the sacrum, right? So this space right in here means I can change the angle of your sacrum so that up and down I can have a changing active response. Much like when you palpate my pulses and you can feel an immediate response to your adjustment, even though it's with needles or fixation or like friction or a magnet, you can feel immediate responses with chiropractic that way too. So it's really cool because your body is a giant network and it's all neural feedback. So your body really knows how to take care of itself. It really doesn't need me. It just needs a little trigger to create that cool response.
What do you do as far as like a trick or something that you can share with the people watching that is like a good way to train your postural observations? When you look at somebody and you notice those things right away, you notice, oh, this person's a low dosage or a higher dosage, or they're going to use this technique better or something. What kind of tricks do you have that you could share with us?
I like symmetry. So my eyes are paired to see underneath your skin, even though I don't have X-ray vision. But I like symmetry. So for instance, if your shoulder is elevated or your muscle is a little bit like thicker or has we're going to call it hypertrophic, but taller presentation on one side than the other, it's how you're carrying or moving yourself. But from the moment you walk in the door and sit on my table, I'm pretty much doing like a moving exam on you to figure out where you're not moving equally from side to side. So my favorite posture assessment like that would be, does it look the same on one side to the other, pending you have an injury or something that your body is always compensating for. When I'm actually touching you, like on the table, I can feel that asymmetry as well too, and I can feel the difference from one side to the other. So for instance, if I adjust your shoulder, I'm probably going to check both shoulders and check movement, which feels like an adjustment, on both shoulders so I can know what the abnormal shoulder is doing. So I can say, we need motion that goes this way because that's normal for you. Everybody's normal is different. If you have a pitcher, your motion on your pitching arm is different than your non-pitching arm. And actually that's your normal, even if they're scapular dyskinesis on one side, according to the textbook. That doesn't really mean anything if that's your throwing arm and it's always there. So, good trick.
Yeah. I always try and watch people, like I try and get them to go down the hallway in front of me.
Yeah.
So that I can watch them on their way to the treatment room. But a lot of times people won't go down the hallway unless I'm leading them down the hallway.
True.
And so it's hard to do it. And then if I ask them to walk so that I can watch
then they're
them,
putting on a show.
Yeah, then
Yes.
it's not what they really walk like.
A fun game that I used to play when I was in chiropractic school is sometimes I would go to a public place and I would guess what their listing was going to be or where their sacrum was sitting in conjunction with their iliums or their hips, right? So watching their movement pattern, I would know where I would like to put an adjustment. It was like a game I played with myself.
We used
I'm
to
a
do
nerd.
that too. We used to do that too in shiatsu school.
Oh, see,
And
that
so
works.
anytime I'll be at a stoplight and I watch somebody walk across the crosswalk, I'm always telling her, I'm always like, hey, look at this person, which leg is off, which is, what's going on with this person.
It works really well on video, so now when you guys are watching this stuff, you can go, I think, and you can have a whole theory. Don't act on the theory, but it's useful training, I guess, information, just to watch your observation skills.
And sometimes you can get in trouble with this, but like sometimes if I'm a little ways back, I will imitate their walk. So that
That
like,
was funny.
Yeah, like far enough back that like they're not gonna turn around and be like, "What are you doing?" But
True.
because then I can feel it in my body, like, "Oh, this
Yeah.
feels like that when you're walking that way."
Sometimes when I'm on the table, you'll see me kind of turn my head and turn my body to the way the patient is oriented, and I'm putting myself in your body. So I'm thinking, I had a little pain over there, and I'm trying to match up muscles and anatomy in exactly the way you just described. It works. I'm very kinetic, so it really works for me.
I had a guy lay on the table one time, and like the way he was laying, he just looked like he was working at a computer with the monitor over here.
Yeah.
And so his head was here, and his feet were there, and his hands were there, or his feet were like this, and hands were there. And he just laid on the table like that.
I do see a lot of that on the table, like talking to me, and their head is like partially turned or rotated, and they have no idea. When they lay on the table in their supine position, sometimes they'll have one shoulder up and their head will be rotating, but they can't rotate their head back knowingly. So it's also information that they are not aware of. So you point that out to them. They're like, I do sit like that a lot. My computer setup is totally skewed to the right or something. So then I recommend that they go the other way so that they don't develop that as an ongoing pattern. Very present in today's society where we're all at our computers, especially right now where everything we do is like at home or on a tiny little device. Kids do that a lot on their phones all day, and you can tell just by watching them walk around.
Yeah. I like it at the
active.
I like it at the crosswalks. It says, like, put your phone down and look up because,
True.
you run over. Mm-hmm. So what about, like, palpation skills? Do you have any tricks for training palpation skills?
A cool trick that we learned in school, it wasn't a trick, it was actually like an assignment, is that we had to put a thread in pages of a phone book and then flip pages over the thread so we could feel when we could sense it or when it kind of disappeared. Like the Princess and the Pea story, where could she still feel the pea after 17 mattresses? It helped us be very attentive to what we were actually feeling or not. Probably we made it up when we were like little tiny chiropractor students, but it's really helpful to be presence of mind when you're palpating that way, because then you're really looking for it. I don't do that anymore, but practice makes perfect, and so eventually you know what you're supposed to be feeling. So practice and patience, but also literally like being presence of mind, present in the moment when you're actually doing the thing, really helps you concentrate on, I guess, a third feeling other than just space and like the perceived notion of what you're going to feel. Intuitive, I guess.
So how many pages?
I don't know. I don't remember that anymore. It was a long time ago for me. I feel like, I don't know, most of my skills I would attribute now to seeing so many patients over time, and just they're all different. So really having to pay attention to who you are on the table. I don't know how many pages. I can't remember that. Sorry. But I'm good at it, so I don't need the pages anymore.
Yeah.
I graduated. Finally.
One thing that we used to do that was fun was needling fruit.
Oh,
like
yeah,
pushing
that's
through
cool.
the skin of an orange until you feel the pulp, or the skin of a banana
Oh,
until you feel
wow.
the pulp, or needling like actual meats and like
Yeah.
until you feel the different layers of fascia and stuff, and learn how to sense all those things that you feel when you go through.
I have some acupuncture training too. So when we did our needle lessons, I think we probably did that too, but I don't quite remember what we used. I think we used our own skin, actually. Because it also hurt if you hit a muscle. And you're like, you're not supposed to hit that. I don't know. That's a good trick. I like the fruit. I'm going to start palpating fruit.
Tofu was one too.
Ooh.
Tofu is like total deficiency. When you needle tofu, that's what it feels like, just needling like a point that's so deficient.
Wow. I ate tofu last night. That's a good thought.
So who is your favorite teacher?
My favorite teacher is Dr. Montgomery. He is like a sage. He's still there at the school that I went to in Missouri. And he taught the technique that I was talking about before, which was Logan Basic. He was more than a technique teacher, though. He was one of those people who lives and breathes chiropractic. So he basically is a walking model of what he preaches, and he just knows everything. He probably thinks he doesn't know everything, but the more you learn, the more you discover that you don't know. And he just did such a good job teaching it, and he was kind and gracious about it all the time. And if you were like to grow up and say, I want to be like one person, that would be the person I would say, if you're going to be a chiropractor, you want to be like Dr. Patrick Montgomery. He knows everything. Limitless vat of knowledge. I don't know, I really respect his approach to chiropractic. He doesn't even do what I do.
So I noticed that too, like so many different chiropractors do this thing and that thing and that thing. How much of like all that stuff is like part of the standard curriculum, and then what is like things people go and do on their own after and like add to their...
I wish there were easy answers for all of your questions, but that depends on the school that you go to. So I am very happy that I went to my school, so we'll make that a commercial about my school. But in my school, I took as many of the, I guess we're going to call them elective chiropractic techniques as I could, so that I would know as much stuff as I could. I wanted to just like immerse myself in all of the knowledge bases, so I would be able to pick and choose in practice what tools to use on people. But every class is going to, every curriculum, is going to have diagnostic stuff and x-ray stuff and how you are supposed to differentially diagnose all of the conditions from one thing to the next. They're going to have all of the requirements to get their board certification. I don't remember what that's called. They all have a standard curriculum that they're supposed to follow. And then they want to prepare you for your boards, obviously. But I took all the extra cool stuff I could absolutely take because it was new to me, and so I wanted to learn as much as I could. I think that some schools are more Western disciplined, and some schools embody a more alternative approach, and some are very principled. By principled, I mean there's a philosophy and an art and a science to chiropractic. So some are all science-based, and some are philosophy-based. Green books, shout out to the original father of chiropractic, and some are more, here are all the different stylings that you can do. So I went to a school that had a really good mix of all three, I think, and then I furthered my own independent adventures just through my extracurricular activities when I was in school.
So I know it's going to be in the comments, like people are going to ask what school. Might as well
I
just
went
say
to
it.
Logan College of Chiropractic, which is now called Logan University in Chesterfield, Missouri, and I loved it. I also got a master's in sports science and rehabilitation there, and that completely changed the way I think about things. I also come from a nutritional undergrad background at the University of Arizona in Tucson, but that really made me think about the different parts of chiropractic, which is not just actually just a bone. It is, without getting into too much philosophy, there's a triad of chiropractic. So there can be emotional subluxations and physical subluxations.
They'll get into all the details.
And chemical subluxations, which are all just areas that your body may not work appropriately. And they're found in different things. Like, for instance, your mind-body connection, or the food that you ate yesterday, or the food you didn't eat, or the activity you did that actually caused you an injury. So I try to touch on all three, even though I'm not an expert in just one in my current practice.
So you're saying what I ate yesterday
could be problematic, yes.
On a physical bone level?
Not on a bone level necessarily, although in long-term scope of health, absolutely, like osteoporosis, for instance. But in a short-term time frame, your body instantly deals with inflammation from putting in the wrong building blocks or food items that your body is going to process and turn into cells of your body. So sometimes food that we eat commonly, like we'll pick dairy as an example, people have an adverse reaction to dairy as soon as it hits their mouth. That's not even an allergy per se, but it's a huge sensitivity, and then sometimes it's an intolerance. So immediately that hits your system, and your body says, wow, I can't handle that. And that's a neurological response that comes from gut inflammation. Gut inflammation can communicate to your extrasensory communication. We're going to just simplify that and say your muscles are going to respond to the extra work that the feedback is giving from the nerves to the spine. So there's a third brain, two brains up there, like two different systems, and then a ganglion or a complex of nerves is in your lower back. And that instantly can cause a bunch of discomfort in your lower back. Sometimes it causes discomfort elsewhere. For instance, I have run into patients who have mental
side effects of eating dairy. And that's not unusual either. Nothing is unusual anymore. Like everyone says, oh, this is a common pattern. You know what? I learned to expect everything is normal now. So it's hard to say something really surprises me just because your body reacts to everything. So IBS, or inflammatory bowel disease, and inflammatory bowel syndrome, basically, is your body communicating that something's not right. So I also have some other advanced chiropractic training in internal health specialist stuff, and that certification is through how your gut actually affects the way your body carries itself. So there's a real debilitation to eating incorrectly, unfortunately.
So what about the emotional one?
That's really complicated
Emotional
too.
subluxations, that's what you said?
I did say that.
I love that.
Emotional subluxations could be as simple as your brain cognitively, you're aware of, blocks your experience in a chiropractic office. If you come in here convinced that chiropractic will never help you, it probably will not help you because you have decided that that doesn't provide any benefit to you. There are people who are afraid to be on a chiropractic table. There are people who had a bad experience at their last chiropractor or their first chiropractor adjustment ever, and that emotional subluxation is going to get in the way of their body response. My job literally then is to find a technique that might work for them that doesn't cause the same trauma or the same, basically,
To relive that trauma or remember
Yeah,
it strongly.
the same response. Like the response itself might be a problem to helping them get over the pain or symptom that they're in. Dr. Montgomery, interestingly, touched on some of that when he would say that there's a lot of emotional subluxation held in your pelvis, just the way our body holds things in layers. In a chiropractic office, we're going to see a lot of people come in who hold their emotional trauma physically, like I'm so stressed out and have all this pain right here and my posture is kind of like drawn into itself. That starts as emotional stress, and emotional stress is coming out physically where we position ourselves in our environment, and then we say, well, we do all this computer work, but we also are like cold, or and that's an acupuncture thing and an energy thing. There's so many layers to emotional There's so many layers to emotional subluxation. It's really hard to describe simply, but there are chiropractic techniques that only touch on that, or emotional freedom technique, which is like the tapping version. There's something called Best out there, which I know very little about, but there's a lot of them, and there's 200 crayons is just too much for me to play with on a regular basis, so I just picked a few. And then if I don't know where to send you, I'll send you to somebody else. Similarly, I could send someone to acupuncture, and you're going to say, well, what stressors do you have in your life? And they're not going to necessarily be physical stressors, but they still show up on your symptom profile and how you net certain meridian imbalances. It's similar in chiropractic. It's immensely complicated and so interesting and fascinating.
I think we share a lot of the same struggle with that particular patient group that you mentioned, where they come in and they're scared of the medicine, right? Because of something that happened or what they've seen on TV or what they heard from their neighbor. And so I feel like a lot of times just getting to the common ground where I can treat this patient is actually the treatment on day one. Right?
Yeah.
Like it's all about what I say to them and how I carry myself to make them feel comfortable in this space so that the next time they come, I can actually do. I mean, I'm still going to do something that looks like acupuncture, but like it's not always until, they've accepted that this treatment is okay and safe, and then we can do something.
Well, your response to them is also layered. They come in and you treat them, and then next time you treat them, you're going to do something different that builds on what happened last time. Chiropractic does the same. I feel like it doesn't always, and there's a lot of viewpoints on that, so I'm not going to diminish a different type of chiropractic care. But what I try to do is make sure that I'm progressing that adds value to your life from one visit to the next. So the first patient's adjustment, a brand new encounter with me will likely not be the same the second time, and that's with intent. So the way to treat probably an emotional subluxation is with intent. So the way that you come to the treatment table and how you've cleared your mind to take care of them that day is similar to something that I should be doing. If I'm not doing that, you probably didn't get the best out of me for that one treatment, even if it was just 7 minutes or less. I don't know. It's very individual, and that's how I love your acupuncture treatment, because I can sense that approach to my own care when you're taking care of me. I'm his patient. Because he's the best.
She's the best.
Thanks.
So where are you going to go from here? Like, what's next? What do you want to grow into? I mean, you're still very young, so like when you're like 50, 60, you know, what do you want to be like, oh yeah, then I did all these other things too?
I want to retire as a chiropractor. I found chiropractic by accident, but it's the best thing I ever did. So a doctor, I think the derivative of doctor in Latin, some long thing that I know nothing about, somewhere means teacher. So I'm not going to stand in front of a group of people probably and teach something, but if I can teach you one thing about yourself or how to make you work better, function, operate better, that's my goal. In the long run, I want to spend my whole life doing that. I think that that's something that I was chosen for, and it found me. I didn't find it. I think that I would love to get back to my nutrition roots before I even discovered chiropractic, and I know that I can really use that information to better people's experiences on the planet. I love my functional care. That is significantly fascinating to me. I love all of the toys, of which I'm not even using right now, but I love things that like make you better in the gym or make you better at your favorite activity and your sports activity. I would love to get back to my acupuncture interests as well too. So chiropractors can do acupuncture in other states with extra certification hours, or programs. So it depends on which state you're in. In any case, in Arizona, for instance, I would need to revisit my acupuncture hours, so I would feel confident, so I could take the state board certification test. But in other states, the state board test is not required. So in that case, I've done a little bit of acupuncture, but the system is so immense that it looks on the outside a little bit intimidating, and that's probably where I would go next. Acupuncture, back to my nutrition. I'd try to be the triad of chiropractic that I was talking about before. That's fascinating to me. And when I'm old, I can still affect people without such a physical adjustment, just by doing little things that have great value to your system. So I want to be in patient care probably forever.
So you have it, continued path to mastery.
Yes, the master sharpening stone. Look at that, full circle.
Anything else you want to mention before we finish up? Shout outs?
I don't really have any particular shout outs. I didn't prepare for that thought. I think that adjunct care is very important from no matter what discipline you're from. So I highly advocate for acupuncture. I highly advocate for physical therapy in different cases. I love a team play. So what I would say is everybody has their own team behind them to help them live their best life. And then I think that your particular team is the people that you pick to take the best care of you. In that case, an athlete never shows up without all of their gear, never shows up without their players on their team behind them, and a coach, and a nutritionist, and a strength and conditioning specialist, and all the people behind them that help make them successful. So every human has that too. And I think that is also acupuncture, and it's also like a really good massage therapist or a functional soft tissue provider. It is also like a physical modality person that's a chiropractor, or they have other terms for that in other parts of the world. But I think we all belong somewhere, and Western medicine belongs too. To some degree, we need a little mix of all of those things. So I love being part of people's team, and if you've not had chiropractic, definitely you should try it.